Good evening, ladies and gentlemen. It's a great honor and pleasure to present here the working of Hemophilia Welfare Society. I work as a consultant hematologist and a medical director at the society. This is the table of contents of my presentation. Yeah. I would like to know you about the establishment of the Hemophilia Welfare Society as already described by the Mr. Fakhre Alam Zaidi. Then I will tell you about about the aims of the society, the advocacy and the government support we are getting for the society, the registration of our patients, affiliation of the society with different partners, the treatment area, the physiotherapy unit at the society. We have a product area, the prevalence of hemophilia in the Sindh province, the CFC consumption which we have done with the help of the World Federation of Hemophilia and the government of Sindh, the treatment programs which are currently running at the society, the supply and demand of the factor concentrates which we need for our community, the success stories and the network and the challenges and the limitations which we have at the society currently. So as said, the society was first established in 1995 by a group of people who belong to the hemophilia community. They were themselves either the patients or the parents. And then it was restructured in 2012 by the founder members, Mr. Rahil, who is the current CEO of the Hemophilia Welfare Society, and Mr. Fakhre Alam, along with me and the other doctors. And now it is part of the Hemophilia Federation of Pakistan. Over time, it has gradually developed into a hemophilia treatment center which caters the comprehensive need of all the bleeding disorder patients across the province of Sindh. Currently in the society we have 25 employees and 2 permanent doctors working at the society, and through the advocacy efforts the society has been successful in shining the light on hemophilia. And this is the success that you are sitting here today. So aims of the society are to establish the state-of-the-art treatment and the diagnostic facilities under one roof. So our patients don't have to suffer and travel a long distance. And to set up more HTCs at different levels of districts across the Sindh province. To raise the awareness from the grassroots levels through the medical institutions, government hospitals, universities, colleges, print and electronic media. And above all, to improve the lives of our patients by providing them free of cost treatment and provide appropriate rehabilitation along with education so they are empowered. They are not dependent on the society. So our main aim is that. So with these aims and goals, the society is currently continuously doing the advocacy with the government people, and you see the government representatives are here with us along with the World Federation of Hemophilia. So we are constantly doing a wide range of interactions and negotiations for our patients to get factor concentrates. Comprehensive proposals has already been submitted to the SBTA. Then we have already done the vaccination, and especially in the Karachi chapter with the help of the government and the SBTA, we did the COVID vaccinations, we did the measles, mumps and rubella vaccination. We have already screened out 900 patients for the hepatitis B, C and HIV with the support of SBTA and the CDC. And this has been done first time in Karachi. No chapter has done so far this. So our society is currently registered with the Sindh Social Welfare Department of Sindh, Sindh Healthcare Commission, with the FBR, the World Bleeding Disorder Registry, and you know very well that Rana is here, that we are already registered with all our patients. The Economic Affairs Division, Pakistan Center of Philanthropy, and the Regional Blood Center. These are our affiliations with different partners who are helping us with for our patients, particularly the Indus Hospital is providing us the plasma products for control our bleeding patients. Their bleeding episodes are being treated, and the NIBD provided us the diagnostic facility specially, and they are very helpful. And now these are the current partners we have with the society. Currently, in the society, we have the treatment area which comprises of 15 beds. 3 beds are allocated specially for the females, so they have privacy. They are not along with the male patients. In each shift, we have 2 shifts, and in each shift, we have a running medical officer, the doctor who was there. We also provide medicines for the underprivileged people, which is provided free of cost. We also have a dedicated physiotherapy unit for our hemophilia patients, and tomorrow you will see in the society that we have a physiotherapist. Dr. Malia is here already. We have different devices for them. We have these things, especially for the physiotherapy for these patients. This is our product area, and we have temperature control freezers, cryofuge for the product making. This is the prevalence of the hemophilia in the Sindh province. Currently, we have registered hemophilia A and B patient 946. And according to the prevalence of the World Federation of Hemophilia, the 3rd edition, means 25 male births across, in the 100,000 patients. We should have the anticipated patients, according to our population, 5,234. But we have only 946 registered with us. So we need to, and we are anticipating undiagnosed patients of 4,493 more patients. This is the patient registry area of our treatment center. The society is linked with the National Hemophilia Registry, which is further linked to the country-specific WFH, World Federation of Hemophilia, and this registry is updated annually, regularly basis. This is our society's breakdown of the 2020-23. This is the current breakdown of our patients. Okay. Currently, we have 776 hemophilia A patients. Factor 9 is 170. Von Willebrand is 132. You can see a huge number of rare bleeding disorders as well. Because the family marriages are very common in Pakistan, so we have also the rare bleeding disorders. We don't over here register the platelet disorders because we don't have platelets to transfuse them. So we usually register only the bleeding disorders related to the coagulation factors. This is the gender distribution of our patients. You can see the males are more as compared to females. And you can see our ages, the population. We have young patients. You can see from our data that our young patients between the age and 24 are more as compared to others. Overall, the population of Pakistan comprises of young as compared to the world. So these are the most common reported bleeds in our society. The most common is the joint bleeds. As you all know, in hemophilics, the joint bleeds are more. So the same is there. In the society, we get the more patients with the joint bleeds as compared to other bleeds. And the most common is the weight-bearing joints. This is very interesting. You can see the CFC consumption, 2023. This is the current consumption. As we are short of factor concentrates, this is the World Federation of Hemophilia consumption which we are using. Because we have so much demand of the factor concentrates and we are short of factor concentrates, so we have to rely on the plasma products. To treat these bleeding episodes, 12,887 bleeds have been treated in the 2023. This is the current data. These are the different treatment programs currently we are having in the society with the help of World Federation of Hemophilia and the Government of Sindh. Thank you. You can see on demand, World Federation of Hemophilia, which provides a factor concentrate, low dose prophylaxis for factor 8, home therapy, then Hemlibra, emicizumab, and from the Government of Sindh, Hemlibra, which is provided to the society to treat the bleeding episodes. And these are the episode numbers you can see here. These are the supply and demand of on-demand treatment. For factor 8 and factor 9, you can see the single dose consumptions of the international units, twice a week units, and for factor 8 and factor 9, and for von Willebrand. These are the 3 most common bleeding disorders in our society. These are the few only rare success stories of hemophilia patients among many of us. Like known case of Bilal, factor 8 deficient, age 19 years. He came from Balochistan to us. When he came, he had the fracture. You can see over here the left femur fracture, and he was bleeding profusely, and he needed immediate fixation for surgery. And unfortunately, his inhibitor titer was positive, and you can see that we use factor 8 and bypassing agent costing 6.3 million. And we were very grateful to the Government of Sindh for providing us factor 7. Dr. Faiz Ali Mangi is here. And he is always supporting us. We are very fortunate and very thankful to you. And Dr. Azra Picho, the Health Minister. And we are getting factor concentrates here from him and the use for this patient. Now another case which is also a resident of far from Karachi came to society in a very bad condition. You can see this abscess, open wound, full of pus. I collaborated with the surgeon and Dr. Shaukat for the drainage of knee abscess. But we needed a factor concentrate huge amount, and we were very thankful to the World Federation of Hemophilia for providing us 40.5 million international units of factor concentrate to treat him. And all patients had full recovery with the help of factor concentrates and with the help of doctors and all the other members of the society. This is our current center opening. This year we had a current center opening, and the Dr. Sajid Jokhio came for the opening ceremony over here. And currently we have 3 district centers in Mirpur Khas, Govt, and this is the main center in Karachi. So in conclusion, I would like to say that hemophilia is a costly disease. It's a rare bleeding disorder, but very costly disease. And the cost and availability of the factor concentrates and the Hemlibra is a major issue for our patients because we have more demand than the supply. After the outreach, we are unable to refer patients because of the basic diagnostic facilities are very expensive and not available in public hospitals. So many of our patients don't get diagnosed, and when they come to us, we have to get the diagnosis done first. There is increased number of emergency case referrals from the tertiary hospitals with multiple complications due to lack of awareness in HCPs because of the latest advancements are not available and the treatment guidelines for hemophilia are not available. Therefore, we need tertiary care services for our patients, and this is only possible with the support of government. In the end, I would like to say that to decrease the mortality and the disability in the hemophilia community, there is a dire need to have a public-private partnership between the government of Sindh, society, the Hemophilia Society and the World Federation of Hemophilia. Through our collective efforts, we can ensure a better life for those suffering and living with hemophilia. This is the medical team at the society. I work as a consultant hematologist and the medical director. Then we have Dr. Sarfraz Jaffrey, the RMO, and the other members. Multidisciplinary team is there to work with us for our patients. Thank you so much.